I knew it was gonna do that. Yeah, okay. Hey, y'all, how are y'all? Oh, we have exhausted. Oh wait, I got red back here. I can't. I ain't looking at nothing. Ain't touching it. I say hi to everybody, and now I gotta fix my comment. So, hey Tiff, hey Facebook Mom, hey Crystal. I don't know who else here. Barbie, hey. Oh, were y'all on it today? How was y'all's day? Love you too, Crystal. I haven't seen you in a while. Hey Barbie. Oh, oh, I'm hot, obviously. Yeah, it's we've been busy today. Like I'm at home, and I had my nurse came, but she had to stop and work a big wreck, and she couldn't had to go like 40 miles out of the way to come back to me to get to me. And then my doctor never got here. And I did physical therapy. So freaking, I'm hot again today. Oh, it's been a long day. Um, I didn't look to see if anybody else was going live when I did this morning because I know somebody was. I think at 5, but I thought it was like at 5:30. Broken. Okay, here's my fatty. Broken crayon still color. My shoes match my shirt. Thank you. Oh, this is my first shirt for May 1st. So that's one. I got 30 more to go. Oh, so, well, I kind of don't know what to do. Start. I mean, maybe people will pop in. If they don't, they don't. Oh, so y'all know that starts Mental Health Awareness Month. May does, and we're all advocates of mental health. Obviously, we wouldn't be here. Um, and and it's a good time to spread awareness. Really, it's all year long. It should be spread, but that's not how it goes. So, unfortunately, the stigma is still there, and we've got to we've got to try to stop that stigma. Oh, that's cool. Yeah, I mean it's wax. Good idea. That's a good idea. Um, so we spread awareness, and I know that most you try to spread it all year long, but people kind of pay attention when they're plastered all over with it, when they see it everywhere they turn or where they read or no matter what. I mean, they see this mental health awareness. So and you can't hide from watching the signs of it. I mean, hey Sophia, they're they're hey Thomas, I didn't see you. Hey. So I thought that I thought that maybe, for the month of May we could really get out there. We can email, we just need to bring awareness to it, educate people because some people truly do not know what constitutes, mental health. Health is health. Brain health is health. Your body is part of it, but people don't see it like that, unfortunately. Hey, Thomas. And but before you really can advocate for something, like I put in the description of this, before you can advocate for something, you really need to know what it is. And I thought, okay, well, for day one, I'll go all the way back to Mental Health Awareness Month and how it was born. And I'm not going to try to be boring with it either. Um, but Mental Health Awareness Month, the legacy of advocacy and change. And May was designated to be the month, but then they changed. There's one in June. Oh God, I didn't highlight this. This is great. October and June. That's what it is. Yeah. So, but we use we recognize May as mental health awareness. So that's what our country has decided, that stayed with. And Mental Health Awareness Month, it started in 1949. I have a little problem with that. Hey, Hot Desert Chicks, how are you, honey? So I have a little problem And I don't know, I might be the only one, but from 1949 to 2025, and we've made what kind of progress? Just the question. What kind of progress have we made? I mean, yeah, we have breakthroughs in medication, breakthroughs in therapy, but are we really where we need to be? That's a lot of years ago, 1949. And I'm not doing math tonight. Uh, I don't know. I have that's my problem with it because we've not had really any big breakthroughs. I mean, not not like in medical, like the medical part of it. But I know it's all the same, but I'm trying to make the distinguish here. Right, Sophia? I mean, I ain't lying. I had mine, I think, today. Um, so they did it to reduce the stigma, raise awareness, and all that. 70, thank you. Facebook. I ain't doing math tonight. So 75 years, and that's as far as we've come. Yeah, we're nowhere near where we need to be. Nowhere. Um, but this annual observance, however, did not emerge overnight. Um, and this is what I was reading when I got this on here. I was like, it says, the roots lie in the tireless efforts of advocates, which we all are, um, who decades ago recognized the urgent need to bring conversations about mental health into the open and challenge social misconceptions. Okay, Thomas, thank you. It was born when the Easter tacos saved millions of lives. Saved millions of and a Black Friday at Walmart. Already running up to my sink. That was a good one. Him and his tacos. But so wait, I'm gonna stop right there on that one because like this I don't know, what do y'all think? I mean, advocates were way back then. And look where we're at, even with the social misconception. I just I don't know. To me, we haven't come far. Um yeah, 1949. So they wanted to let me do it like this. Hey, Criminal, how are you, Ben? How are you? Um, Tony, hey, Sandy, I should have waited. How are y'all? Oh, but so all right. And I know history is boring to a lot of people, but I wanted I mean, I have a freak. Hey, Nicole. Hey, hey, Aunt Dana. Oh, y'all look, the stranger's here. Hey, Aunt Dana. Thank you, Tony. Yeah, I'm just a little rounder and pudgier and not enough hair, but that's okay. I accept it. I just accept it. Oh, and I have a tumor, so I just accept all that. Oh, my Aunt Dana. I do have a report. My phone recognized my face 3 times today. We're making. Oh no, we're making progress. Aunt Dana, no, no. Do you see what you're looking at? Do you see? I can't even wear my clothes. Right? So go buy me a new house. I mean, a new wardrobe because I did that already. I got in trouble because I bought clothes that fit me. I went and got in the hospital for 15 days and all my packages came. I got in trouble. 'Cause I can't order. Hey, how are you? So I cannot order nothing else. Uh, and I need to save my money for bail anyway. I'm sorry. I'm just always gonna laugh at that. Uh, the rest of this they uh the after the war. they played a significant role in highlighting the importance of mental health, especially with the returning home vets, and that's where it grew from there. Um, so wait, hang on. I don't know. Let me see. Oh, you want one of these shirts? Yeah. I don't know when I got it. Thank you, Aria. Thank you, Tony. Ugh, I'm just thank you, Aria, for doing that. I really appreciate that. Thank you. The channel thanks you. I appreciate it very much. Where is what I didn't do it? Okay, so here we go again. Oh, I'm tapering down the steroids again, and it started yesterday. So yeah, I guess I'm on the half. I'll be through. Ugh. Um, what am I trying to find? This. And please don't. Come on. Where is? Yeah, I'm still learning this. So oh, I gotta mute myself. Okay, it is. Yes, I have to do this way. It's weird. Uh, okay, okay, and there we go. May 1st kicks off. There's 5 memberships. There y'all go. So now we have 5. Hey, Body Illusion, how are you? Oh, I gotta turn this off. I can't do it. Yep, gotta go away. I cannot watch YouTube and stream hard side by side because of the delay. Ugh. Um. Okay, where was that? Giving history lessons that nobody likes. Let's see. So the Mental Health Association. I'm a broken crayon too. Trust me, I am that. Oh, so what was I saying? Squirrel. No, the Mental Health Association. They laid the groundwork for Mental Health Week, and then it went into mental health awareness, and then it's went. What is going on in the chat? Hang on. My desert chicks. I don't see what happened. I did not like I didn't like history. No, I didn't like it in school because I was always math and science, and I hated English and history. Then you go to law school and you find a whole new love for which you should have done. So, um, I was only just like given how. Hey, Miss Shah, how are you? Love you, miss you. Oh, now my glasses are gonna fall because I'm too hot again. Ugh. You're right. I agree, Thomas. Um, so now let me find where I was at. um, oh yeah, they went from hang on, mental health week to mental health awareness month, and that's where we're at now. Um, after that, it went. They just went around trying to educate the public about mental health and stuff. And to the from the beginning, they have tried that. That's what they've been working on: advocating, ground roots going. I mean, they really did a lot to change and evolve for Mental Health Awareness Month. And but we still have no clue. I mean, they have no clue. It's supposed to be changing the landscape of mental health awareness to the understanding and needs. Y'all, I just don't get it. I did all this. I mean, I did the work to look up all this, um, but we got to keep going. Will it take 75 years? So since 1949? No, we're not where we need to be, but If everybody does their part, just a little bitty part, even if it's just making somebody's day better, um, it'll get there. It'll get there. We might be already 75 years, but it may be the 76th year that it happens. Because my problem is when things happen, like, and I'm not going to say anything about to get me in trouble on here, but right, Sophia, that's what yeah, exactly. Um, I can't say that because I'll get this will get stricken. Can't say that word. Forget it. Let's go to something else. I'm not even going there. Um, I was just going to talk about the way things evolve. But like when something happens, like something that happens to our kids in school that we're scared to death of, or something happens in the, um, one or two people go just do these atrocities or however you say it. I don't care. What's the first thing the news always reports? They say, "Oh, he's got to have a mental illness." I get so sick of hearing that on the news because do they ever, when they find that it's not a mental health issue, go back and do the story again and correct it? Nope. They leave the stigma. They leave the story. I've never seen anywhere that has retracted their statement. No news station ever. Because the first thing they do is start talking about mental illness. Oh, he must have a mental illness. And then let's find out, no, he didn't. No, he didn't. He was, he was diagnosed with anything. And then And then, but y'all want to scream mental health. But when you find out that it's not a mental health issue, are you going to take that story, replay it, and go and correct it? I've never seen it. It would be a miracle. And yes, I'm being a little sassy about that part. It just, I've been doing this for 21 years and it ticks me off. I've been trying to convince people we are stronger together for so long. I do not get why humans like to put labels and cause division instead of embracing with the love. And that is exactly right. Misha, that's exactly right. I mean, yeah, we're stronger together. We are stronger together. Who I don't know. You have so many that just don't. I don't know. People don't think like some people don't think like we do, or they do. I mean, everybody has a right to their individual thoughts, but it's guaranteed that 1 in 5 people will has a mental illness or will develop one. 1 in 6 1 in 6 knows somebody or has them as family that has a mental illness. So it's not like everybody can just, and I think the numbers are even less than that. I mean, you know, uh, when I did my paper on it, it was 1 in 5 and 1 in 6, and now I think it's 1 in 3 and 1 in 4 because I think it was only three. I think yeah, thank you. That's what I thought it was. And so if you put 10 people in a room, how many people are going to have a mental illness? Yeah, and it's we have so what about helping those with the need for help with their mental health instead of shaming it? That's our world is so backwards these days. That's exactly right. I mean, all right. That's why I'm so glad it's Mental Health Awareness Month because if you bring up mental health around anybody else, that it's like taboo. And I know for sure that I've come across that, especially the people in the neighborhood where my facility is. My residents can walk down the damn street and go to the store if they want to. Okay? They don't have to call the cops every time they round the corner or go out there and threaten them or anything like that. And so I get, more than 10 times a year. So times that by 21. Every cop knows where we are. They know where my facility is. I'm a mental health facility. Hell yeah, they know where it's at. But here's the thing. They still detain them until I get down there. Somebody gets down there and says, yes, that's my resident. Yeah, they're allowed to walk down the street. And then they want to start being real shitty to me. I say, and guess what? They can even vote. Bet you didn't want to hear that. And I am not lying about that. That is God's honest truth, what I tell them. If they want to keep pushing me, when my residence has just as many rights, rights. Hey, Stasia, how are you? Just as many rights as we do, if not more. They are allowed to walk down the same road we are. They're allowed to go to the same stores we go. So guess what? Every time they do that, I've started doing it back. And Stasia, hey, I'm sorry, I've got brain fog, and I knew if I stopped where I was, I wouldn't remember where I can't remember crap. um, but so when you would think 'cause we have the same neighbors. I don't think anybody but two people have moved. Hey, Misha, I love you too. I don't think anybody has moved but two people off that street, the whole street. Love you, Stage. I'm so glad you're here. Hey, Dana, yeah, and they are all at their baseline. You're exactly right. Yep, they're all at their baseline. I mean, you have the right to refuse your medication, but you do not have the right to refuse it and remain there. Yeah, love you, Stage. Love you. And I mean, I hate to say it, but and you're right on that, Sophie. I was fixing to get Sophie. I was fixing to get to that. Oh, so Sophia got me. She's on my next subject. It is meant to keep people unwell. That's what we. When I was reading this, it said that. Let's see. Wait. Well, it talked about the vets and the soldiers coming home with PTSD, and that kind of made the whole mental health broader. Um, and then it expanded, and it's what we have today. Um, One of the key figures in the early mental health reform movement was Clifford Whittingham Beers. He experienced the first hand and harsh reality of mental illness and inadequate treatment. Imagine that. Um, Prevalent in institutions at the time. It's powerful. He's got a biography. It's called A Mind That Found Itself. It was published in 1908. So, yeah, having a little hard time finding it. But he was also he after all that, and he published his book, and he chronicled the abuses that he witnessed at the time. And that's when mental health, was at its worst, when they were doing all those horror stories that everybody knows about. But A Mind That Found Itself, and I wish I could find that book, but let's see. And it said that his abuses he witnessed, and igniting a national conversation and fueling the drive for better care and understanding. And he was the one that helped them form the National Committee for Mental Hygiene, which was before it turned into Mental Health America. So that's where we're at now. Ah, Mississippi Burning Stage. Yeah, I've seen that. When I find a movie I like. Mm-mm. Um, what happened? Where? I gotta. I looked down and she's gone. I hope she's able to get back in. Red just disappeared. I'm back here by myself. I do like that one stage though. I like that. So yeah, I think that yeah. We actually had to watch that in school, I think. I think we did. But okay, so if you ever want to know what the closest you can get to knowing what severe or what, the schizophrenia is, it and oh hey, I was like by myself. Oh my gosh. Hang on. Oh gosh, I'm trying to get this right because y'all know that my brain has got brain fog right now, and I promise you. Mm, I am okay. Okay. I just told her hot desert chicks. She was texting me, so you don't have to. Um, so mom, because I can't remember things like I'm supposed to, ever, not since this medicine. I just started my fifth week. I have 4 weeks left. Uh, but my mom sent me. We were talking about this. She said watch one. She said watch One Flew Over the Cuckoo's Nest. She said that one right there is. She said that was with Robin Williams. Uh, uh and A Beautiful Mind with Russell Crowe. And A Beautiful Mind. That one is as close as you can get to watching what is an attendant effect of the medications that they experiment on everybody with, or what is the, you know, you always have an attendant effect, and then you have a I ain't gonna be able to say it because my mind's not working right now. And the desired effect. There, I knew it would come to me. But has anybody seen A Beautiful Mind with Russell Crowe? Okay, well, I have. And if you want to know, you have One Flew Over the Cuckoo's Nest, ain't Dana? Yeah, my mom had sent me a text because she was watching her YouTube, or no, I'm sorry, Netflix or something. I don't know what she was watching, but she's been a psych nurse my entire life. So like since I, so she's been um but she said, just FYI, this is her text to me. She said, if you want two good movies about mental health that portrays an accurate depiction of mental illness, watch One Flew Over the Cuckoo's Nest with Robin Williams and A Beautiful Mind with Russell Crowe. And I had already seen that movie. She said, A Beautiful Mind is based on the true story of when Thorazine was made for an antihistamine, and they discovered it was an excellent antipsychotic drug. So that's when they came up with the intended effect and the desired effect. Um, and then my mom was saying, she's like, I used to teach pharmacology. Yeah, my mom's got her master's in nursing. So, but she said, and she made all her students at Lamar watch A Beautiful Mind as an assignment. She said, just a thought for May Mental Health Month. Hey, Rick. Hey, Lord Kids. I'm everybody that came in. Fight the illusion. So, um, oh, so Robin is in another one. Oh, my mom, mom. She don't, oh, wait. Oh, wait, the awake. Who is in the awakening? There's a few, but um, I'm in alive. I will take care of this after that, y'all, please. Thank you. Um, I'll never find it again. Okay. So anyway, hmm Hatch. What does that mean? There was, I don't know. There's several of them that I watched that, but one flew over the cuckoo, but Beautiful Mind. That's just, if you watch A Beautiful Mind, that's like mental illness wrapped in a nutshell right there, and it truly is. There, they tried out Thorazine. There was supposed to be an antihistamine. Now, can you imagine us taking Thorazine? Oh, okay, Aunt Dana. All right, literally, I mean, oh, we got her for an antihistamine. Yeah, I bet the people did quit sneezing or coughing or whatever they were doing. They probably quit breathing if you give them that much Thorazine. But it's crazy. So I'm like, wow, yeah. So that movie is a really good movie, and it makes me cry every time. So just beware. Oh wait, Patch Adams. Yeah, a woman under the influence is another one with. Oh wait, hang on. Another one with Gina Rollins and John. That's what it is. Woman under the influence. I gotta. I have to write it down. All right, let me just take a screen. A picture of it. Hang on. Okay, I got it. Thank you. Thank you. Thank you. Uh, there's a lot of. I mean, there's so much. Hey Rick, run of the. Oh Rick. Let's see. So after all that, we have Mental Health America, um, and it's evolved to what we have. It says the changing landscape. This makes me laugh too. The changing Over the years, Mental Health Awareness Month has evolved to address the changing landscape of mental health understanding and needs. Each year, Mental Health America and other organizations often focus on specific themes to highlight during for mental health well-being. Um, right now, they're trying, as in today, they are literally um, they do educational campaigns for sure. I know they do that because I have my mental health first aid from them, and then they do mm, try to increase the public's understanding, but public don't understand crap. Um, I mean, when you have an officer at your facility because you have a resident that is clearly a danger to themselves, clearly, I can't say anymore except clearly you can see she's a danger to herself. And I get the answer from this brand new patrol officer, sheriff's office. I'm going to be nice. She tells us to bring them back where we got them from. Where have we come in 75 years? I mean, literally, a law officer told me, go bring them back where you got them, or bring them back where they came from. And I had an employee standing beside me. Let's just say Keela lost all her marbles that day. I'm surprised I didn't go to jail for it. I think the only reason I didn't go to jail for that day is because I had my office camera that points outside my office where we were standing, and another one both recording, and she knew that. So if she would have pushed it, that would have all come out what she said first. I don't I don't do it. I do not, cannot, will not ever stand and listen to somebody downing anybody with a mental illness or the mental illness because it's not like you can just go pick what you want to be sick with. And mental health is health. Like it or don't, we're all, I mean, you got to have the brain to help the body. We, we've all talked about it before though. We just cannot get, um, we just cannot get people to understand that don't know. So, so oh, that's why I called the members on here advocates, when we started out. And okay. Shoot, I'm sorry. Oh gosh. This is work. Hang on. I can't ignore this one. Mental health week mental health month has begun. Oh my dear Lord. Okay. Just be good long enough so I can finish with this. um, okay, hang on. Oh, Stasia. What's Stasia? I work with so many dealing with so many issues. I'm the lucky one who is the shoulder they need. I help as much as possible. And like I tell everybody, not all heroes wear capes, truly. But you're who they need, who we need. Because sometimes all it takes is an ear to listen. Not Don't try to fix it. Don't there's nothing you can do to fix it. Just you know, sometimes people that suffer with mental illness, I mean, even depression. Well, I think they moved depression to no. What is it? Yeah, it's depression. They moved to medical or anxiety one. I don't know. They moved one to like the medical, not the brain. So, but you think I would know that, but see, my brain's fried right now. Um, and then uh, and I'm squirrel. I'm gone. I don't even know. I'm gone. It's gone. When it's a call to a mental health facility or private citizen call for someone in mental distress, there should be trained officers. Okay, and staff member available to accompany these types of calls. All right, so let's talk about this one. Real life, as like happens all the time in my place, like as in real life. Um, so if now we're not a mental health that takes them off the streets. We're long term. They already have to be. They already all have to be at their baseline or as good as they're going to get with their medications. We do not take them. We're not a homeless shelter. I don't like that, but I have to protect my other residents. So, but on that question of wait, Brad, can you put that back? Can you grab that real quick? Okay, so when we would be like the private citizen because we don't have the our mental health is like at the hospital. We have two facilities. One's at one hospital, one's at another. So it's not like we have my mom ran the crisis unit that we did have. It was strictly mental health, but they closed it down. That's when she retired. And we need it now more than ever. Hey Tamara, how are you? So but when we call the officers, yes, it's supposed to be trained officers. Do you know in one county, and I don't know how many people are in our county, we we have a great I mean, we have a mental health officer. He works Monday through Friday, 8 to 5. Yeah, I have his cell phone number. It goes to voicemail, and he'll call you back like way later. And then he shows up and tells all my residents or whatever that need him that he'll be out there every week to visit them and see them and talk to them. Won't answer the phone. Um, we have one mental health officer for this entire county. This entire county. I tell the officers, I'm sorry, Red, you can take that down there now. um, so I tell when they show up, because okay, so my residents get mad. One of them gets mad because they didn't get an extra cup of coffee because there wasn't enough for everybody. And this is true statement, true story. This happened. um, she didn't get a third cup of coffee like she thought she should. And trust me, they live for cigarettes and coffee. And so she starts pitching a fit, and I try to tell her, don't act like, don't act like you know, a- don't act like that. So she got to try to hurt herself. Okay, then we have to send her to the hospital. I mean, we have to call. But what's funny is even if my staff call 911, the dispatch calls me and says, "Was it y'all or is it a resident?" Because the mental health officer told them to call. So we have to teach them these sheriff, the men that I mean, none of them or the woman have a damn bit of anything in mental health. Exactly, nothing in mental health. In real mental health, they have all they want to do is tase them. Well, I have a resident that took the tasers out and took it from them and tased the officers. She went to Rush for about 2 years, which is the state mental health facility, and now she's back with us. She's fine. Just don't tase her. That's a true story too. I know that none of the other residents even mess with her. Hey, Phil, how are you? How are y'all? Oh, yeah, and it can be dangerous because okay, so I'll tell you how dangerous it is, really, Tiff. Oh yeah, when they have multiple mental health diagnoses, it's so hard to treat. I mean, it really is. I mean, you sometimes you have to see you have to, you can't do both sometimes, and it gets really bad like that. And I have to watch my mental health because we have hospice, and if they like the ones with the rapid cycling or whatever, or they're just in psychosis or just whatever happens. Um, I have to watch and be mindful of my hospice patients too because they can't handle all that excitement, and all that screaming. And I've tried to teach my employees, like I tell them every time, they want they're trying to draw attention to you. I mean, from you. They want you to see them. They want you to talk to them, but they're going about it like, in not a good way. So it's not adaptive and it's not a positive behavior. We don't reward that. So what we do is, um, well, I mean, we tell them, when you can act right, or I mean, you can be correctly, come talk to us, whatever. Hang on, every time this comes up, I'll forget what I'm talking about. I don't even know what I was talking about. That was what aggravates me. Sorry, y'all. I have 44 text messages sitting here. I don't know what's going on there. Um, yeah, ours is Stasia. That's what I'm hoping. Let me go there first, Stasia. I'm hoping that one of these years that we're going to make a difference. Somebody's going to listen. You know, I mean, they brag about how far we've come. We haven't come that far, and absolutely, Stasia. Just they want people to listen, just to hear them. They don't want to be fixed. They just want to be heard and seen, and that's it. Most of them just want to be heard and seen. They've come to terms that it is a lifetime illness. But yeah, no, it's usually my hospice patients taking it on is the problem. They're mean. But no, people think they want to bring them there. No, they have to be stable to come to my place because I have from 18 and up. So, and some people that are there have been there for 21 years since we've been open. So, you know, governments and big companies want to call us mental because we are easier to control by them. Yep, that pretty much just summed it up. Big pharma. um, but like I was saying earlier, I don't know. I don't think you're in here, criminal. What I was saying is, they want to get on the news. As soon as something happens, like a mass, whatever, and or a school, God forbid, whatever, um, or terrorist action. I mean, anything. Okay, so anything. But and this is what I was saying earlier. When I don't think there was very many people in here when I said it. I'll say it again. But they want to get on the news and start calling it. Oh, it's got to be due to a mental health issue or mental illness. A mental illness. There's your stigma, right there. The news media get up there and say, "Oh, it was due to a mental illness." Well, when they find out that it wasn't, that this was planned, that a sane mind did this, do you think they got up there and said, "Oh, wait, it wasn't due to a mental illness"? Hell no, they don't. And that's where the stigma keeps staying. That's just bullcrap. They don't ever get up there to say, "Oh, well, we made a mistake," or "We blamed it on mental health or mental illness, and it wasn't. It wasn't all along." Hell no, they're not going to do that. That's when I get pissed off. I'm not passionate. That's when I get pissed. Now, I am passionate about it because I was in a little convenience store by my work, and our neighbor at the end of the road come in, and he was over there talking about, yeah, all the crazies. Oh my God, they had to call the sheriff's department on me because I educated that man. Facts and statistics he got, and he won't ever forget them. And I looked at the sheriff's department. I was like, "And you're gonna do what?" Tamara, I would be itching too. I feel. Who else is it, Rick? Chamber. I'm miss. I'm just trying to. I'm missing all the things because I'm really trying to stay focused on this. Um. So, uh, they now promote the new thing now that's come around is promotion of self care, and I'm glad that's finally on the list, and that just happened this year. So self care, we always preach self care, but not even the mental health America focused on mental self care until this year. That's crazy, literally. And yes, they do have a big platform or a crucial platform, and they do advocate. They do, and they share stories. I mean, I have to give them that they do. But they said their goal remains consistent to increase public understanding of mental health conditions, challenge stigma, and ensure that individuals feel empowered to seek help and support without fear of judgment. And yes, I agree with that. um, and then it goes into the what Sophia was saying a while ago about you have the the eugenics, what she was saying, because some people can't afford mental health treatment. So I mean, It's a real thing. Like my mom worked it. She ran the psychiatric crisis unit for this whole for Jefferson County. Well, actually, the whole area. It's the only one we had. And she would get them stable. Hey, Brian, how are you? Get them stable, and then guess what? 2 weeks later, she has to put them back out on the street, stable, taking their meds. And 2 weeks later, what happens? Cops are bringing them in again, and it was a revolving door because you need think about it. If you had to choose between a place to live, food, or medication, what are you going to do? We're all going to do it, I think. You know, I mean, medicine would be my last thing because I need a place to live and food, or medicine ain't to me any good. And stage, yeah, like people have a choice to have a mental illness. No, that's right. They can just mask themselves in a way that nobody notices, and they can't get any help for it. Sure, good one. Because you know what? That's a real good one. Um, People don't choose to get diabetes. You can't see that either. I don't get it. There's no difference. You can't go take an X-ray to see if you have diabetes. You can't take an X-ray to see if you have a mental illness. Jeez. And people with mental illness are way less violent than the average public. Do the statistics. Because people with mental illness are raised in that constant fight or flight. And it's very exaggerated in, if they're not on medication. Or they have 50 voices telling them it's something else. And that's a true fact. And I think I told you about the little skit that we do for training purposes. Like we have everybody sit in the middle, and then one person starts when the one employee or whoever will have to, stands up and is just standing by the wall. And then each person starts saying like, you're ugly, real slow. And the next person will start, and I would keep saying, you're ugly, and then this one say, kill yourself, or unalive yourself, unalive yourself. And this one will be saying like, you're trash, and it goes all around, and then everybody is saying it louder and louder at the same time. I didn't When it was my turn, I didn't even last not even 13 seconds. 13 seconds, and they have to hear this stuff every day, 24 hours a day. Imagine somebody that's not medicated with schizophrenia that can't do anything about it. You know, there's so much work that needs to be done. And I know that we're not able, like, just one person, but if that one person does their little part, everybody does their little part, things can change. We need more for mental health. Texas is very last in mental health resources. The last number 50. I don't know what's going on until they have. That's what I was looking at. Nothing seems to get. Well, that's where, yeah, that especially mental health, Brian. um, that's where we come in. People like us. People just using our voice so they have a choice. That's all I can say. And so they've taken and taken, and nothing seems to give. But then that's where I am scared mostly. The hubby is getting there quickly. It's a scary world. Yes, it is. But you know what? I know you used to take this, Misha. Um, I do have something about that. Okay, it is getting scary out here. Um, there are because mental health, you know, and I hate to say this. I don't want to even say the word on my channel, but I'm going to say it. Even during election period where everybody wants to put mental health right up there in the front, right? Everybody wants to use it up there, and let's use the hell out of that term. And then it's forgotten. It's gone. Till the next time. Until the next time. Oh, we're going to put that number one. Oh, really? Where? In the trash? That's the first place it goes. You have to, you have to, as my mom has taught me, you have to keep talking until somebody hears you. She gives me advice all the time, but that one's been for a long time. You keep talking till, "Hey, half." Oh, it's fine. Um, you keep talking. You don't. You're here when you're supposed to be here. Um, and she's right. I mean, she usually is, but she's really right. You don't stop. Yeah, never shut up. That's what we do. That's exactly right. That's exactly right. She, my mom, okay, so she is exactly. I'm not trying to fear bait or anything like that. Just trying to bring the reality that goes beyond the talking. That's exact. Yes, thank you for doing that because it's the truth, and that's where the problem is. Everybody wants to hide behind the stigma. No, we want to get rid of the damn stigma. That's the point. Mental health is health. Healing is not linear. I mean, there's a lot of things and I'm not excited. Like I have to tell everybody, I'm just passionate. Oh, all right, good night. Thank you for being here. Oh, y'all. But they can't even keep the veterans. Okay, yeah. Oh, you want to turn? You want? Oh my God, my blood pressure's been high all day. I gotta get it down. They can't even keep veterans off the streets and seek help in a country that has a bigger military budget than the next few countries. So why would they care about everyone else? I agree. Everybody in my family, well, no, I can't say everybody, but most of my family, they're either veterans or they're in the military. I mean, they're either currently there or they retired. My sister retired from there, and then I mean, like my uncle is still MIA POW. I mean, he's dead now, I'm sure, but in Vietnam, he never come home. But we never got his body back or anything. So it was I mean, there was nothing in there. We just went to the grave, and then But when they started playing taps and those shots fired, mm, it was rough. But our veterans are here. You know. Oh, Brian, that's good. That's good. Yeah, because most of them are horrible. I mean, they should be the top-notch hospitals in our country. Like, this should you should walk in. I mean, like, that should be like the top notch. That should come first. Because you know what? Would we still be here or have a country if it wasn't for the veterans? I don't know. Good question to think about. And I just thank everybody for their service because, like, yeah, like I tell my family, my brothers, my sisters, thank you. I mean, that's the most you can say is thank you because there's no words for it. And I don't know, just all of this. It takes a village, all that. And Misha's right about the rich get rich, the poor get poor. Whoever said that, about when you don't have the resources, what do you do? That's exactly right. What do you do? So what I think that's something that we all should be worried about. It all depends on how complicated your case is, and mine is not really complicated. Right. But that's what I just said, Misha. The vets should be first. Yeah. I mean, they should be first. They should have the top-notch hospital in the world. Like they should have the best of the best of the best instead of the worst because we wouldn't be here if it wasn't for our veterans. Yeah. So yeah, it's okay. Oh, when vets came in, we couldn't get them transferred fast enough. That makes me want to keep talking, babe. And let's see what I'm trying to explain it. Just because you can't see the bruises doesn't. Oh, Deb, that is exactly right, and that's a true statement right there. I was talking to someone in a verbally abusive relationship and was trying to explain that just because you can't see the bruises doesn't mean it hurts less and doesn't affect your well being. Well, well, well. That's something I would not have put together because my brain's not working. But that is exactly correct. You can't see the bruises. Just like I always say, you can't see that the pancreas isn't working and you've got diabetes. Yeah, you can't see if somebody has a mental illness by taking an x-ray of their brain and crap like that. But this right here, that's just perfect. I mean, that is exactly right. Damn. That's kind of profound. Kinda got me speechless. You're exactly right, Deb. Thank you. We just get free dental care for people who can't afford dental care in Canada, and it should be in place for the next few months. Now we need the same for mental health care. Yeah. Um, well, here in the US, you don't get free anything. You don't get free dental. You can't get if you can get mental health care. I mean, really, it's I mean, Texas, for the love of God, how big it is, and we're last in mental health care resources. Yeah, San Antonio, I've heard had a good VA, but I didn't know. Yeah, that VA hospital because we had to take some patients over there before. Yeah, that hospital is a good one, and there's so many resources that that we there's so many resources that we don't know we have, and they count on that. I mean, really, they count on us not knowing we know, you know, and it's not just the veterans have to come first. Just give them the care you promised them for doing your dirty work. Yeah, and be there. Yeah, when they come home, it'd be nice for somebody just to be there. I mean, we sent them over there. We should be there when they come back. That's just my feeling on it because my family's military. Um, then Misha says I stay freeze, flight, or fear mode and have since I was 17. So that is from a cortisol dump and an adrenaline dump, and when you do that fight, your anxiety is the I gotta quit watching this. Um, the frustrating part is there are so many resources and the red tape and crazy making that occurs to even find them. Welcome to my world, sweetheart. Yes, absolutely. Try doing it for like 20 or 30 people. And that is exactly true. There really is there's resources out there. You just got to know where to look. And guess what? They don't tell you where to look. They don't want you to find it. They want you to give up because then they win. I mean, and I say they, meaning a broad group of things like big pharma. Um, but think about it. They don't want you to find these resources. They have to put the resources out there. I mean, where we came, and then oh my gosh, hang on. The resources are there, but if they don't spend them, they don't use them. So we don't want to tell everybody that we got these resources because we might have to spend this money on it's everywhere. It's just a broken system. It's frustrating, and they want you to give up, and they send you down every rabbit hole till you actually have hit rock bottom. When it would have been so less expensive on their asses if they would have just given you what you needed to begin with. I don't understand that part. I don't understand. Right, Sophia? Yes. Take take care of everyone. Don't prioritize anyone for anything non-medical related. But if you promise them medical care, give it to them. Yes. Yeah. Uh, it's really there's so many resources. Yeah, that Texas wouldn't be 50. Texas would not be 50 when it comes to mental health resources if people knew where to look and find those things because there are so many there, there are so many people and so many roadblocks, so much red tape, down so many rabbit holes that and then you actually find out it's not even a damn rabbit hole. You got to turn around and go back out. I mean, literally, this is what they count on, and it's sad. And I'm going to say allegedly, and in my opinion, so I don't get the shit suit out of me for saying that. But they want you to um, give up. That's the whole plan. You're going to give up. Well, guess what? I've been working at my facility. Hey, Lori, I've been working at my facility for 21 years since we've been open, and I don't give up. They lose their patience long before I do. My mama taught me. You keep talking till somebody hears you, and don't you just don't give up. You let them give up. You win this fight. Hey, Lori, how are you? Sophia says the cynical. Wait, oh, I mean the even the victims advocate. I have been asking for help with therapy for over 2 years now. I get ignored. I have paid. Hey, oh, how are you, Lori? Um, hey, Thompson, how are you? Oh, thank you. My- Thank you. I don't feel it. Yeah. And tonight, I mean, it's just the first day of May of Mental Health Awareness Month, and so it just kind of went back to where Mental Health Awareness Month, how it became, and then what it stands for now. And I mean, if we're going to advocate for mental health, we need to know what it's about, right? Like we need to, we need to know what we're talking about. Hey, Thompson, how are you? Lord gets free cake. Okay, so I know y'all been in there. Cynical part of me would say survivor benefits are cheaper than ongoing treatment. I'm glad you said it, so I didn't have to. Yeah. So already, okay. I'm gonna look this up before I say it. I fact check myself all the time, but I'm gonna fact check this before I say this. I can just do it on my phone. It's way simpler. Okay. Yeah. Um, the average lifespan for someone, I know this statistic, and if it's right, I'm gonna get so mad because I'm looking it up. Like, it's gonna be what I know it is. I hope. And don't talk. Yeah, I was right. I don't like to be right, but I'll tell you, I was right. So no, don't read it. Okay. The average lifespan for individuals with severe mental illness um, is significantly shorter than that of the general population, with estimates ranging from 10 to 25 years less. I was going to say 25. Um, this means that people with conditions like schizophrenia, bipolar disorder, and major depressive disorder may die much earlier than their peers without these conditions. Some research even suggests this reduction in life expectancy is compared to or worse than that associated with heavy smoke. And then there's just a whole bunch of stuff um, due to their quality of life, and how many times they've tried to unalive themselves or they succeed in unaliving themselves. I mean, that all goes into that. But, and it's really sad. Mental illness can vary depending on the specific diagnosis and the severity, of course, of it. Um, access to treatment and support, lifestyle factors, and overall physical health. Like it's very, and then we have the disparity. You have integrated care, no care. That I mean, it goes on and on forever on there. But that is exactly the worst part, and it is easier to let the elderly, the ones that, how do you call it, don't have the the quantity left. They don't care about quality, but the quantity. If you're about to be where you, oh, Lord Christopher, thank you for being here. I appreciate it very much. Thank you. I know I said I was only going an hour. Okay, I'm fixing to get off here too. Um, but we need to watch, we need to look, we need to educate. Misha, I'm fixing to get off. I was only going to be an hour. I'm over actually. Um, if you apply for thank you, Lord Christopher, Misha, y'all, both of y'all, love y'all. Let If you apply for financial assistance, they cover all departments. I gotta talk to you, Tiff, about that. Is that like where? Because I don't know. Good night, Lord Christopher. Okay, I'm doing my iced coffee now. On the tea. Misha, love you. Love you. Stay. Stay. Okay. Oh, at the college. Okay. Wow. My insurance covers probably ain't gonna cover me ever again after this. But I'm serious, y'all. If they'd have just given it the first time and not let me get so sick, then it wouldn't have cost them so much. And that's my point about all this. If you treat the mental illness before they have to be hospitalized, if you pay attention to them, you don't just, oh, okay, okay, okay. Treat the mental illness. Bye, Brian. Thank you. Thank you. I appreciate you being here. Have a good night. If you treat that's just like a broken bone. Like if you treat it now, you can keep from having to pay for all the surgery on it that you're going to have later on. I mean, it's ridiculous. It's like they don't even think straight. And I'm talking about insurance companies and all that crap. I mean, I fight with them every single day over all of these residents that I have and all my patients. And I've got a stack down there that I'm still going through. I'm not through yet. So yeah, it's it's traveling down the road less taken every day because it seems like people are getting farther and farther away. They're not, nobody communicates anymore. And now the division, that's true. That's true. Whoever said that, I think was it Facebook Mama said that. I don't know whoever said that. That's the truth though about we used to be not divided, and now this whole country is divided. And if we weren't, we could, it takes a village. We would be there. We could have people stop the stigma. Oh, oh man, I see you've got a broke arm. I'm so sorry about that. Oh man. Oh, you got a mental illness. I'm so sorry about that. Should be no difference in saying either one of those sentences. But it is. It is. And when they start putting labels on once you label, I was so mad, let me put it this way. I was so mad at my doctor's office. I mean at the hospital when I read all my chart, I said, I never once went in there and told them they've got this documented that I have a past medical history or a current medical history of low back pain. I said, Mom, this is bullshit. I don't want that on my records because I don't. Oh, it's Michelle. Okay, thanks. Um, I mean, I was really mad. Yes. I was like, that sticks with you, and then other doctors see that, and what do they see when they say low back pain or any back pain, especially from a woman? We're hysterical or we're drug seeking. And what I think is funny is nobody wants the drugs I can take because I can't take the narcotics. So it's like, I'm not coming in here being a drug seeker, dummy. Give me a shot of anti-inflammatory. But it's just I don't know. Insurance companies make them compete. Yeah, you read your charts, Lawyer. It was in my chart that low back pain. I said I want that off there. I actually want that diagnosis off there because I don't want to be the somebody see that because it's not true. That is not what I came here for, and I don't have that. And it was ridiculous. I made them take it out of my medical records. Simple enough solution: create a truly open market for insurance companies. Make them compete. So right now in our country, I think the only ones that are really competing, the rest of them are kind of don't know what to do and they're backing up. Yeah, the rest of them are bought by big pharma, but the ones that are competing is the Medicare, the Medicaid for the Medicare Part C. Man, when it's open enrollment, I get sick of them damn commercials all the time. But yeah, Lori, I read my charts too, and I'm gonna tell you something. I made them take it off. That's why I read my charts. I made them take that off. I was not. I said I've never been in here, never complained of my low back. I swear to God, so whoever's got my voodoo doll can just quit for real. They need to quit because mm, let me get a sip of water. I mean tea. I have so much written down. I don't know. I don't know where I'm gonna go with this. I don't want to get upset about it because I am mad about it because the big pharma and all that, and that does get to me. It does because people shouldn't be dying because I can't get medication. And just like with what the hell are y'all what? I'm talking. Oh my God. I love y'all. I needed that. Um, where am I at? My mind is everywhere, so it doesn't matter. It's not everywhere. It just won't stop. Uh, let's see. So here's where this is where I like to go for my information. Okay, like if there's anything up to date, any webinars, any I watch. And they have people that tell their stories on there. NAMI, National Alliance of Mental Illness. NAMI. All you have to do is NAMI. NAMI is if I ever had to pick, an entity for mental health, NAMI. They are world. I mean, they're known and they're proven, and they are active, and they have resources, and they fight legislation. I know because one of the head people of our the NAMI that's over our division. Her and my mother went to Austin and wrote the legislation um, for places like ours that there's never been any laws or any rules or regulations or even a health and safety code because this didn't exist. My mom was the first one, to come up with this, and she went with one of the head honchos, which was her friend though of NAMI, and they wrote the legislation. They got it passed through the House and the Senate. They did not leave Austin until it was signed into law, and it was signed into law on September 1st, 2009. And my mom wrote that, and I'm very proud of her. Now, there was a few strike throughs that they did, and they had to go back and forth, but I'm so proud of her because she helped get us the health and safety code for the state, guidelines, rules, regulations, so they could be regulated, because otherwise you would just have abuse after abuse after abuse, which we still do. Um, let's see, I don't understand why so many Americans can't see the benefits of universal health care we already pay to be denied access as it is. Tell me why. Tell me why. I don't know. It's big pharma. I mean, yeah, I don't know what else to say. It's like I did use the system. I can't stand hospital administrators. It's always the money. Yeah, it's always about the money. Hospital administrators, hospital board of directors, they're going to tell doctors and nurses what they can and can't do. That's what they're going to do. I mean, and they will fire a doctor if they don't do. I mean, they don't let doctors be doctors. Well, we had that hashtag going a lot. Hashtag let doctors be doctors. But the insurance companies get to be doctors. The pharmacies get to be doctors. It's all bullshit. And then, um, and then you've got wait. USA is the only country that people go into bankruptcy because of health. Yeah, they put it on your credit report. Absolutely. In fact, I'm dealing with right now. I got to take care of tomorrow because I put the wrong insurance in. So I'm like, come on. It's ridiculous. The y'all, we've got to there's got to be something that can be done. And I know that we are just we're just a few in all of the voice, but collectively our voices can be heard. They don't I don't know, they don't prioritize mental health. But mental health is physical health. Mental health is health. There's no damn difference. I mean, if you don't have a stable mental health, might as well forget about your health. I mean, like, really. And I ain't ashamed. I said it today. I said I had to tell my doctor my mental health is getting taken a toll. I told him. I'm sure I'm gonna talk about that. But I mean, my mental health is taking a toll on me. Just being inside. If you tell Germans the world would have to pay up to $1,000 for insurance to have a copay on top of that, and to stay in network and can be denied for arbitrary reasons, you'd have a revolution. Words of wise Sophia. Yeah, think. Yes, it happens every day. And somehow we're the greatest, richest country. In what reality? In what world? Yeah. What world are you living in? Because we not. I love my country. my family has fought. My uncle died and never been brought home for our country. But are we really who they fought for? Are we really the best we can be? Are we really treating our citizens like they should be treated and not letting our vets sleep on the street and not having resources for mental health? It's all together. It's big money, big pharma. It's ridiculous. It's hospitals, but I did use that system. I knew that what was going to happen. Yeah, so I'm the first person in history to start that treatment. Hey, body illusion, love you, love you, love you. I know I need to shut up. Love you. Have a good night. Um, so I'm the first person that they have that started the treatment I'm on inpatient because it's an outpatient treatment. But they started me inpatient because, and I mean, I didn't know what else to do. I let them. Of course, the medication got denied by my insurance. Absolutely, it did. That's too much money for anybody to pay for medication. So when they did the appeal, I was in the hospital, so the hospital got behind me and pushed for it, and that's how I got approved for my medicine. They had to start me inpatient though, because they had to tell the insurance company and prove to the insurance company that I was inpatient starting this. Oh, it's fine. What? No, you don't feel like at the moment. Tiff, what's going on? I missed something. I know my mind cannot even stop. Like I have freaking brain fog from this medicine. But that's exactly they started me on an inpatient. I'm the first one on record to get this treatment. The hospitals, I let them fight for it. I let them fight for it. They pushed all their bureaucracy and shit. Oh, you said I wish things were getting better. Yeah, I do. I do. I wish they were, but I don't. They're not. Um, Start me inpatient on a $34,000 a month medication. And the hospital says, well, she's inpatient. They pushed their whole administration shit pushed and made the insurance pay for it. That's the only way I would have got it. So yeah, I had to play the system. I mean, I was impatient. It's not a lie. I was impatient, and there are like actually 7 days after I started it. I was there a week after I started it, and but if I wouldn't have been impatient, I would have never gotten approved for that. I'm not big enough to fight insurance companies, but the hospital was, and it's sad when it comes down to that. Insulin costs 25 euros a month here, and insurance just covers that. Insulin costs so much money that you can't even afford to save your life here. EpiPens and insulin. How the hell are they so expensive? It's just like this is going to be the start of a month. I got to take some anxiety down. I can't believe the state our country is in with mental health. They closed down the only crisis center around. So guess who? Guess what the biggest mental health facility is? Guess what? Everybody gets it. The largest mental health facility is the criminal justice system, and that is fact. And that's that. Jeez, Tiff. Yeah, the insulin shortages are bad. The insulin and the damn EpiPens because they cost too much money. Yep, yep, yeah. The criminal justice system is the largest mental health facility we have, and it's sad. It's so sad because some of my residents, they're all going to have some. No, not all. I don't. Okay, most are going to have a criminal record. They live on the streets. They don't have medication. What do they do? Just slap them in jail. That's why where my job comes in is to go through their background as I do their assessment, go through their background to make sure they don't have any like SA charges or anything to do like that or unaliving them someone or something like that. As long as it's like, oh what, they got trespassed? Why? Because I was trying to get some food from somebody. I mean stuff like that. I don't even look at. But I mean, if it's something big, yeah, we can't take them. But if it's Oh, what, they got trespassed because they had nowhere to go. They were living on the streets. Big deal. That's what we're here for, to get them off the streets and get them help and get that. But the number one question we ask every resident, every potential resident or patient that comes to us when we go do the assessment, the very first thing after I introduce myself is I ask them, "Are you wanting to come here?" Because if they don't want to be there, I'm not going to waste the whole 2 hours it takes to do an assessment on them in background. There's no reason for it. If they don't want to be there, they don't have to be there. We're just the choice. They don't have to take that choice, but they have that choice, and that's what matters. It wasn't patented because it wasn't supposed to be too expensive for anyone, and now companies allow people to die for greed. Yeah, they do. Big pharma doesn't care. It's all about the money. Follow the money, follow the money, follow the money. Y'all would not believe how much some of this mental health medications cost. I I don't understand it. Honestly, I don't understand how you can charge because it's Medicare and Medicaid because they have a disability, they have a mental illness that they got on disability for, so either they're usually on Medicaid if they haven't worked and they've had this disability for a while and they didn't work enough, or if they did, then it's their disability, not SSI. And but I can tell you this: the medications, the medications that they take, they would never be able to buy them. One injection they get. There's some of mine that take the monthly injections because they're not severe. So that's like the only thing they take. It's just once a month, antipsychotic medication once a month, and it works all the month. And but they're stable, and they're young. They're young. But I say young, they're in their 30s, 20, and 40s, low 40s, because they've been there so long. I still look at them as a kid, like when they first got there. But they just take that one injection. That one injection is over $2,000 a month, and that's just for one person. So I'm saying, what the hell, big pharma? You can't be sick. You can't, and sometimes Medicaid is trying to, and like all they have is Medicaid because they weren't that old when they come, that hadn't worked. Literally, Medicaid will fight to not have to pay. I have one resident that is on 4 antipsychotics, but he's stable. He's been stable the entire time he's been with us, which has been 10 years now, and he's stable. And I got him like when he was like 20, when he was young. And yes, he's on that many antipsychotics because that's what works for him. I shouldn't have insurance companies questioning the doctors or the psychiatrists. No. If they prescribe it, there's a reason. They get to sit behind this plushy desk and whatever they do and sign their lives away, their papers, and say, oh, well, this one we can get rid of, and this one, yeah, let's go ahead and cover this one. That's just what I picture in my mind goes on sometimes. They want you to think the drugs cost that much. It's their profits that make meds cost. Yeah, it's big pharma that cost them. Yes, it's 100% big pharma. 100%. This is what I freaking with every single day at. Every day, that's what I have to deal with. But you know what? I'm still here. I'm still dealing because I'm not going to give up. And I take my mom's advice to heart. Keep talking till somebody hears you. And that's where we're at. So I know I have lots of advocates and voices and choices, and I just say we need to find, which I always go to NAMI. I educate myself as much as possible for my continuing education through NAMI because they have so many good seminars, webinars. They're really awesome. Um, that's the sad truth. That's the sad truth, though. I would never move to the U.S. because of the medical system there. You couldn't pay me enough to move there with the system. Sad truth. That is fact. That is fact. I can't. I don't even know what to say. It's fact. Y'all, oh my God. It's red. Hot. Hey, I'm the noise opera. Love you. Love you. Love you. How are you? Oh, so I figure like if I can do this. Oh wait, ladies, y'all asked for it. You got it on Saturday night. Has everybody made sure y'all have looked at that? And man, How are you? I'm the North. Um, they're right. You're Red. I agree with you on that one. This place is crazy. This the United States should be the insane asylum. I tell my residents the only difference between me and them is I have the keys. And sometimes that's not a true statement. Doing good, keeping busy, good. Yes, we're gonna try to kick off month, mental health awareness month. So, if you just see something, I think it starts with little movements. If you see something on TV, like I sit here saying like a million times about, if a news station that or something bad that happens, and the um, news station, remember that somebody because I'm gonna have to go back there. I got to respond. Take a minute from every book. Protonics is what I take, and it's $140 a month. No, $240 a month, and that might be just what they charge my insurance. But mine's Protonics, and yeah, what it costs for 3 months, it costs for 1 month. Here, that if that's the one. So wait, what was I saying? Somebody better help me. Y'all know I won't be able to remember it. I can't remember anything. It's my short-term memory, and I'm talking short. I say one word, I forget what I'm talking about. Okay. News, Protonics. Oh yeah. Okay, wait. News. Yeah, news station. Okay, got it. Thank you, Red. Y'all. Thank you, Marie. Oh yes, news station. That's all I needed. Now I got it. Okay, so if you see a news report from a news station, screaming, "Oh, it was mental illness! It was mental illness," and then you find out it's not mental illness, just the smallest act of picking up that phone and calling them out on it, that that they got it wrong, they need to retract that. Just a simple phone call and tell them you want to speak to their boss. Then you get it. Whoever you're talking about, you want to speak to their boss. You want to speak to their boss. You just keep doing that until get somebody to hear you, or you're at the top and you tell them that was a false statement. Um, you told me that it was mental illness. You told the world that it was due to a mental health issue, but you find out it's not. Have you went on there and told your audience that it's not? No, that's why we still have a stigma. That is exactly why. That's just one example. The one voice can make a difference because it's not just one voice, and then it's someone else, and then it's someone else, and you make a difference. We might not be loud as one, but we're stronger, and together we're louder. Prescription meds are free here in Ontario under the age of 25. They are talking about getting a drug plan going for everyone who needs it. Sometimes that just makes me sad. We can't treat our own citizens like that. It's really sad. I don't understand how there wasn't a revolution yet with those conditions. It's so bad. Y'all don't know how expensive Big Pharma owns the freaking government over here. Everything revolves around Big Pharma. I don't care which way you go. I follow the money. It all goes back to Big Pharma about who gets what and when they get it. When they jerk the oh God, what was it? What was it called? 'Cause I'm not gonna know the COVID, the transfusion. What was that called? Yeah, this is where I can't even think. Um, they jerked it from Texas, and I don't know where else. They jerked the transfusions that actually got you better quicker if you had COVID. Well, the government took it from our state and said that there wasn't anymore. So we would use something that they're big. No, not Paxlovid. The one before that, the actual transfusion or whatever it was, the with the IVs and stuff, and it was working. They were giving it to everybody at first, and then they said there was a shortage of it. But they actually the government took it from the state. Actually, no, not ivermectin. No, it's the treatment. It was a treatment in the early, but it was by IV. People were going to get the. Oh my God, my head can't think. I'm sorry. it was the like not it wasn't Paxlovid or ivermectin. I took ivermectin and hydroxychloroquine, and it gave I've had it 6 times and probably half and half. It was an antiviral, but it was by IV. Like you could request if you had the symptoms for so many days, you could go and get that. It Oh my God, Stacia, you're saying the moon. Okay, I gotta go outside and see it. But don't tell me the state took it back from the medical system. The state, that's exactly, that's it. That's it. That's what they did to Texas. The government took it. The federal government took it from our state because whatever we didn't agree. Oh, because we opened back up or whatever. Not remdesivir. No, that, Lori, ooh, that is one they were using, and that killed 2 of my residents. Run, death is near. That's how you say remdesivir. Run, death is near. They gave that to 2 of my residents that died. That's who I had. I was on X. Well, it was Twitter then, and they had the Twitter Spaces. And one of my friends, that's like a reporter. She lives in Dallas. Um, Texas Lindsay is what she goes by on there. She had me on there, and we did like a 3 hour space, and I had like I don't know how many thousands of people, all the doctors in there. This is when the remdesivir was real big. I was so pissed off because my resident didn't have to die. They gave it to him knowing he couldn't take it, that he had had kidney dialysis before, and that is absolutely the one contraindication of remdesivir. Run, death is near. And they kept him for 20 days, sent him home. He only lasted 3 weeks. When he left, he was laughing and joking, and there was nothing. He had no symptoms. We had already been treated him for COVID. He just was still shedding, but did not have any symptoms. What we did was send him to the hospital because he drank 2 of his nebulizer treatments. He thought they were shots. No, so I read. So I literally, I'm like, Jeff, what are you doing? Oops. Well, I guess it don't matter now because I said his name all over Twitter. I said, Jeff, what are you doing? He's like, I got a shot, man. He's just an old cowboy. He wasn't even old. He was only 50 something. And he got me to do his Facebook Live. Oh, all the time. Like Facebook, because he would drink. That's why he had to go on. He had to go on dialysis because he was drinking mouthwash to try to get the alcohol. We buy mouthwash that doesn't have alcohol for that reason. Because we have people that are recovering there. But Jeff, just a old country boy. I mean, he was so sweet, the sweetest person like you would ever see. Helped everybody. He sat out there and played his guitar, singing Hank and Merle. I mean, he was just like an old country boy. He had his boots and his hat. That's what he had to have. And I don't know what made him do that, but he ripped open both nebulizer treatments and said we couldn't grab him. We couldn't do anything. He just did it. So we called poison control, and they're like, he needs to go to the hospital. Well, because he was still shedding the virus. He'd already been treated. It wasn't even active. He had no symptoms. But because he was still shedding it, they put him on the COVID floor. And me and a doctor got into a screaming match. I said, you cannot give him that medication. That is the biggest contraindication. Kidney problems, kidney dialysis. He had been on dialysis, and that doctor, it was at that hospital. He read it off to me where he saw it. Oh, I see. This was back in 19. I'm like, so you see that he was on dialysis, correct? Correct. Why are you going? Oh, he is not going to. He's already had 2 doses of it. I don't have to have your permission, his permission, or a family's permission. The federal government gives me permission. Swear to you on my life. That's what the shit we deal with here. Jeff come home. He was there from February 2nd till the end of February. They sent him home the beginning of March. He died 2 days before my birthday on March 24th. And you bet your ass I was right there holding his hand. And I promised him, I said, the world will know your story. You are not dying in vain. And on that Twitter space that we had, and there was a lot of people like that in the double-digit thousands. And that was just like in a week. But during the live, there were so many people in there. I'd already sent Lindsay. I'm glad you're there. I am too, Lori. I'm so glad you're here. Thank you for being here too. Oh, Google's not helping. I know. So what? Google. That doctor gave him remdesivir. No, he couldn't stop saying all the pictures were his IV obviously infiltrated because in case y'all didn't know, you can't be mentally ill and physically sick in the state of Texas. Just like y'all know that. You know, you can't be physically sick and have a mental illness. No. They want to send you straight to the mental hospital. That's it. I mean, that's serious. You know, send one of my residents to the hospital for a medical issue, and they know that they have a mental health issue. They don't help them. They send them right on over to the mental health hospital when that's not even the damn reason they went. And and that's a true statement every time. You can't be mentally ill and physically sick over here. And so we make sure people go with them. But I told Jeffy he wasn't going to die in vain, and I kept my promise. It was it hadn't been a year. Um, it hadn't been a year. Our the attorney still has has his paperwork. Remdesivir is fixing, and Big Pharma they're fixing to get it because you know I have a great lawyer, and so did he. So I told him he didn't gonna die in vain, and Lindsay helped me keep my promise to him. But it was right at it. It was right before a year, and we did that Twitter space, and there are so many stories just like Jeff. I didn't know there were so many stories just like Jeff. The doctor gave remdesivir without informing anyone because they didn't have to. The federal government gave those doctors free reign over our bodies and whatever went in it. They did not have to get consent. So Jeff died. I have all his paperwork, all his labs. I have everything. That doctor did that. They had already given him 2 freaking doses of this shit before they even told the family or me. I don't think that doctor would have ever told me, except he wanted to brag that he can do whatever he wants to do. Well, we'll see about that. It hasn't come yet. But right here on Jeff, you could tell where the IV infiltrated. It was nothing but a black. I mean, it was huge, blue and black. It was huge. I made sure them pictures went straight to copies of those pictures went to Lindsay, and she put them up the entire time we did that 3-hour Twitter space on remdesivir. And I read off all the labs, and all the doctors in there were like, "Holy crap!" I mean, like his D dimer getting so high, I've never seen anybody's that high, and that's your clotting factor. I mean, literally, run. Death is near. Don't go near remdesivir. They got so many class action lawsuits against them right now. Funny. Yeah, to read that real quick. I know this. I'm gonna try to find this because I know what it. Um, what was that stuff called? It's making me. Yeah, the government took it away from our state when we needed it. It was the infusions. That's what it was called. That's what it was called. Infusion. Um, monoclonal antibodies. There, I said it. I found it. The monoclonal antibodies. They took it from us. That's funny. But Barbie, yeah, Saja, yeah, it is. Oh, hang on. I got my big chair out. It's a little taller. Um, but it turns. Um, that's what it is. The monoclonal antibodies is what they were giving like pregnant women that got COVID because it actually right there you don't have COVID anymore. Like that was a great treatment. I mean, it was already pre-made, and y'all, like that right there helped so much. If you had the symptoms within so many days, you could go get the monoclonal antibodies and that infusion. They ripped it from our state. They ripped it. We didn't get any more. They kept saying they're out of, they had a shortage. They had a shortage. No, they came and took it from us. It, I was just like, wow. Because my doctor, his wife is a nurse, was pregnant and got COVID. And like she was like 8 months pregnant and she got COVID. She's a nurse. And so they called to get her an appointment to go get the monoclonal antibody. So the baby went, and that's when they were finding those blood clots through the umbilical cord. And they didn't want that to happen. So now he's a doctor, she's a nurse. You think they should have had no problem getting an 8-month pregnant woman that's a nurse that monoclonal antibodies. She had to fight for it. They were jerking it up left and right. They had to go to every resource they had just to, and then she had to be monitored every week and then go in the hospital because of they were scared of the blood clots and stuff like that. But they almost didn't give her that monoclonal antibodies. So that really, that's really all we could do. That's funny. She sipped it slowly. No one ever enjoyed a lax. I have had one resident that thought she was Queen Elizabeth. She was sitting on her throne. We were all her servants, and she lived in a castle. Now, why would we tell her any different? This woman had severe schizophrenia. She had no family. Why would we do keep most of them reality orientated? Or we if they're able to. But if they're not like she wasn't, why not? Why bring her? Yeah, we're your servants. This is your throne. I mean, she until she passed away, she thought that was she was living in her castle and we were her servants and she was Queen Elizabeth. People come and say on her, oh no, you're not. Why? 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 Why not let her feel good on in her last days, then try to reality orientate her when she's never gonna be that. If she was happy in her castle, then why evict her? No, she is okay. Oh, I got you now. Yeah, yeah, that's what I'm saying. So why ruin it? Why ruin her? I mean, she didn't have that long left. We can be her servants, and this is her castle, and she's Queen Elizabeth. If that's what makes her feel better, that's right. She's the queen. Oh gosh, Stacey, I can imagine. I don't know if I have this patience for that. And that's right, Barbie. So right. Like why try to tell her she's wrong? There's no reason for that. Why? I mean, you have like I still have one right now. She is the queen of the whole place, and don't mess with her, or everybody's gonna whoop you. She's my oldest lady there, and I mean she's already died twice, and we brought her back, and she's still there. So okay, she's important. I aspire to be like her. She's 74 years old. She's got the most severe case of schizophrenia. For the first 10 years we had her, we never heard her say anything except this one word, and it was the voices telling her. And she was getting dementia, but we all we knew about her is that I mean she never spoke in 10 years. Well, we sent her to a hospital because she started kind of going down. Um, she kind of started going down on her mental health. Like we couldn't get a balance. Well, we got her to Louisiana. Oh, and this is like one of the bad hurricanes too. No, it was Melda. That's what it was. It was Imelda. Because me and Daryl were going over to Louisiana and they had her over there in the hospital. And they called me to ask me where they wanted her transferred. I said, wait a minute, why do you have her? I thought she was at this hospital. They never called and told me that they had moved her. And I was so mad. And because they're supposed to keep up with. But yes, you remember from the party. Yes. She's so freaking sweet. She she is the bomb. She is the boss. She goes shopping at night. So when hey Paige, so when everybody wakes up and all their shit's gone. No, it's not. No, no, no. She passed away, but hey, the one there, she is the queen. She shops with her little rollator. She takes everybody's stuff all night long. And when they get in the morning, they just go to her. They give it back, please. They don't even tell it nobody anymore. She went shopping. It didn't go nowhere, I promise you. She just went shopping. I'm like, she's been shopping again. Just wait a minute. She's so funny. Oh my god, she's so funny. And yeah, the no, I was she passed away, Barbie, and that was so sad. Hey, Paige. Yes, Tip. It was so funny. Stacia, that's exactly right. Like down our like when we got her back. Listen, y'all, literally, so keeping them happy, you're right about that. You know what? When we got her back after Imelda, after she got through the hospital, and we didn't think she would, because she was gone for like over a month getting treatment. I mean, they couldn't find any medicine that would keep her stable long enough. And and so they just it's a trial and error, especially with somebody elderly like that. You don't know what's going to affect their blood pressure. What happened was they put her on one of the older antipsychotics, and one of the side effects, I mean, one of the things you have to watch for is aspiration pneumonia. They have to have their blood work done before they can even every month before they can even have their medication filled. It is so regulated that the pharmacy has to be registered with the state, the patient has to be registered with the state, the medication has to be registered with the state, and the doctor that prescribed it has to be registered with the state. And you have to have their labs to the pharmacy to even get it filled. That's how strict this medication is. Like everything has to go in a straight process, or if one person falls off, then they're out of medicine forever. And then I have to deal with it. But um, they had tried her on that one, and she got aspiration pneumonia. So she was in ICU when they called me. I was like, "What the hell?" And then I start getting ugly with people when I do that. But anyway, um, but they finally found something that balanced her out. She was 10 years. Please understand when I'm telling y'all 10 years. I swear to you, 10 whole years. Where were you at 10 years ago? Okay, 10 years. She never said a word except one word. We would try. We would talk to her. She would stand out in the yard, and she would do this. You stun. That's all we ever heard from her. You stun. If you did try to have a conversation with her, you stun. And it was something her voices were saying. She had and it scared me because now she will mimic what her voices are saying in their, like what she's hearing. She will mimic in that voice. I was in the back bathroom in her hospice room. The bathroom is through their room, right there off the room. I locked that door and I called the staff. I said, "Somebody get in here." There's like 4 or 5 people. I don't know who the hell's talking out here in this bedroom, but I can't come out of the bathroom. They all started laughing at me. They're like, "It's just Miss Beverly. She's imitating the voices she's hearing." I went, "Oh my God." I was like, "Well, she's got a bunch of them." And they're men, some of them. It scared me because I thought I was just to walk out that door and I didn't know what was going on. It's often easier to enter their reality if it's safe enough for everyone. They are happy. Yes, they are happy and more calm. If they cannot be reality orientated, if they can be reality orientated, we want to do that. That gives them enough time to be in the present moment. If Because if you feed and like with her, it I mean, like with why we're in their dreams. Why I mean they don't have nothing else to look forward to. Like Miss Beverly, and y'all all seen her online. She's like I've got permission to talk about her anyway. Um and y'all seen her on the Facebook Live or whatever I did live for them. Maybe it was YouTube Live, yeah. And for their Christmas party and stuff. But she said when she walked in, she got off the bus, we were scared, or off the little van that brought her home. She hadn't been there in a month. We were scared that she wouldn't remember. She walked up, she goes, "Are my pull ups still down there?" I'm talking. What? You said one word in 10 years and now you're asking full questions? I was like, shoot. And then I'm like, oh God. I said, "Well, Miss Bev, do you want something to drink?" Because we didn't even know what she liked to eat or drink for 10 years. She said, "I want a SAMSCOLA." She wanted a Sam's Cola. What do you do? Go get her a damn Sam's Cola. Exactly, Sophia. Yes, 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 absolutely. And that's right. And Stacia, yes, try to understand as much as possible. And then, y'all are right, all this. And I have anxiety, how many got, okay, so that is a real thing. That's a real thing too. I mean, that really is because I never had that until, like I said, there's a before and a after. Ours is this damn pandemic. I mean, there's life after, before 9/11 and after 9/11. Now there's life before COVID and after COVID. It's just, I had to accept it. And I don't like it because I have anxiety too. Yeah. and it's hard for me to get out of the house and put in public sometimes. Thanks for always being nice, and that makes a world of difference. Just a smile, just a smile. People want to be seen, they want to be heard, and if there's in like you just giving her a smile, you know what that did? Probably you will never know how much that did for her, and that's the great thing about it. You, if you just try to understand them, meet them where they are. Like I have to tell my employees, don't expect these residents to meet you where you are. You get your ass in there and you meet them where they are. They're all here for a reason, or they'd be on their own. They don't live where you work. You work where they live. And yes, that's on my wall at work. Right? You work where they live. Remember that. And if they, if the employees and all of us treat them like they're nothing, like they're never going to make it anywhere, that's not a good thing to do. Reality orientation is important, but not for somebody like Miss Bev that is 74 years old. That's got the most severe case of dementia and schizophrenia that I've ever seen in my life. So why would we try to throw her back into something that's not? I mean, try to tell her she's not so and so. I wouldn't do that. I would not hurt her like that. I mean, she's on hospice. Why would you do that to somebody? You wouldn't. I don't think anybody really would unless you're just freaking an ass. But yeah, this month it's gonna be a little. I'm gonna do my best to because I don't have much going on this month except sitting at home. So I'm gonna try to do some more. I actually want to do some a a couple times a week at least. At different times, like when I went late that last time, then I went early the next time. I don't know. Just it just depends on who's coming. I didn't even know that I was supposed to see the doctor today till they called and said she's on her way. So I mean I don't know, but I'm gonna do as much as I can. I'll be posting like on the page on the community post too, and and they get sassy. My smart comment station. Yeah, that's funny. I give everyone the same treatment except those I know the most. They get sassy. My smart ass comments always make them laugh. And you're the kind of person that's exactly what I would need. Oh my gosh. Being kind is easy. It should be the default approach everyone uses. My God, wouldn't it be great? Wouldn't it be great? It's just the only way we're going to be able to do this. And I mean, literally, like you just said, we have to lead by example, and we have to get the word out. And people look at hashtags, and I've been hashtagging everything today with um and stop the stigma, in the stigma, mental health matters, mental health awareness. I mean, like everything that I've put out there today, I've tried to tag it because people look at those tags. And right now it's a big deal. I've seen a bunch of channels already on here. Let's kick off mental health awareness month. When you never talked about mental health once in your damn life. It's a big thing to talk about. That's where the stigma comes from. They only bring it up during this month or the first day, and then it's never talked about again. I have problems with that. If I have problems with that, then I have a problem with it. And you know, we're working on some. We're working on some. Oh my God, I think. Ah, well, that's so. I found out you didn't laugh, but listen again. I try my best. Lead by example. Yeah, instead, that's good. Don't ever give up on anybody. Don't ever give up because you don't know what that one seed planted is going to do for somebody. Because there's a lot of people who wanted to go home. It's late, stay tonight, and see about tomorrow. Yes, yes, yes. Facebook mom, yes. Because they'll forget about it by then. If you could just get them to sit still. So, and that's what we do: educate, educate, educate. That's why this was so boring. I didn't mean to make that information so boring, but I thought I wanted everybody to know like where it came from, like where mental health awareness month came from. Because you can educate someone else about that. This has been going on for 75 years. When are we making a move here? You know, it's just if we never speak out and we don't step out of our comfort zone and make others step out of their comfort zone, they're never going to do it. And the reason they're never going to do it is things don't change until the current situation becomes too uncomfortable to remain the same. And that's fact. Yeah. So education is the key. I told everybody, come to, especially the ones running their mouth in the neighborhood and calling the cops on my poor residents, like walking down the street to the store is a crime. No, they have more rights than you do, and they can even vote. And that's exactly what I told that asshole. But anyway, but my neighbor down there that did that was in the store, and that's the one I kind of jumped on when he was in the middle of the store. Educate whenever possible. So you don't even have to have freaking statistics, nothing. All you have to do is tell them, you know, 1 in 4, 1 in 3. I'm telling you, it went to 3 to 4, but I'm going to stick with my statistic that I know I'm not going to fact check it because I know it's right on this, or it was right. 1 in 5 people will, 1 in 4 people will develop a mental illness, or 1 in 5. 1 in 6 people know somebody or somebody's in their family with a mental illness. Now I'm telling y'all, I think it's 3 and 4, but I'll have to go back to it because of social media. You're going to know, you're going to deal with it. You can't just pretend it doesn't exist. So stop making people feel like a piece of shit for coming forward and trying to get help. That's where I stand on it. Bottom line. The stigma is out there because of people that don't know what they're talking about. So they need education. Because of news media that don't know what they're talking about. They jump the gun. They need to be educated. Police officers need to be educated on mental health. There's so many things that need to be done that no one, it's at the forefront. Oh, when we need to use this mental health story, let's use it. But let's not worry that we don't retract it. That's what gets me the most. They can jump on there and start saying, the first thing they say is, oh, it's mental illness. Oh, really? Okay, now when you found out it wasn't, did you retract it? I'm telling you, it pisses me off more than anything. That's where the stigma is. So it's going to be up to us to stop it. My sister and I shop in the same stores. My sister didn't understand how cashiers that never smile or talk to her will always smile at me, and I have a grudge. Told her, just smile and ask, how are you today? That's right. Yeah. Yeah, just smile. Be kind. You don't know what battle everybody's fighting. You know, that's the sad part of it. And some are fighting it all alone. And that's where we come in here. It's higher than 1 in 6. I think it's 1 in 4 now. That's what it is. I'm not sure. I'd have to go look on that one. But people need to know they're seen and heard. And they need to know who's going to be standing there with them as they go through a bout of psychosis that they never knew they had. That's a hard, harsh reality to face when you have your first break. That's a harsh reality to face. That you're going to have this for the rest of your life, and that you just had your first break. It is so very sad to watch that. And damn our country for doing this. I hate to say that. Be kind to other people, even in the shop. Even in the shop can leave us with a wonderful experience. Yes. Just be kind. It's so much easier to be kind than it is to be mean. You feel better. It is sad. Yeah, if you use mental illness as a default excuse, at least make sure something is done about it. Yes. And even my residents, like I tell them, mental illness is no excuse for bad behavior. And they hear that all the time. Mental illness is no excuse for bad behavior. That you do not get a pass on that. If I know you're taking your medications. I know this. No, you're not going to blame it on your mental illness. Now, what the hell's wrong with you? You're acting like a 2-year-old. Yeah, I do talk to them like that. When they want to act like that, I talk to them like that. But they want to hear what you got to say. So if you get real quiet when they're mad or screaming or something, and you just talk like this and you don't say much, you just keep getting quieter and quieter, they're going to stop screaming because they want to hear what you're saying. So there's just a little tricks on everything you can work, until you can get people calm down. Our place, it's calm. They go to bed after the last cigarette at 9 o'clock, and their meds. They go to bed. So it's like, and then Miss Beverly gets up and goes shopping. And there's cameras everywhere. And the only bedroom that I have cameras in is we have to in the hospice room to make sure that because there's only one staff member working both houses at night, and they go back and forth washing clothes at night. So it's funny though because I'll flip on the hospice camera and I'll see like it looks like a ghost. She's got her blanket over her head and her walker. And there she goes out of her room. I was like, going shopping. And the employee will be at the other across at the just other shop. I'll tell you what room she went in. But they cannot leave anything out. She will get it. But you know where it's gonna be. But all right, well, thank y'all for being here so long, listening to me blabber. I just thought that maybe this is an important topic, especially with it being the first day. I just want everybody to know that like where I stand, I'm advocacy. I'm their voice, so they have a choice, and that's the only way some people are going to get a choice is we have to be their voice, and we're not going to stop until we're heard. May take another 75 years, but guess what? At least we got a little farther than we've been every day. So, yeah, thank you so much for being here. I really do appreciate it. Thank you, Red. Thank you, Mods. Thanks to everybody. And I know she had some start questions. Let me see. Aria and Tomas, thank you both. Tamber, Philip, Stasia, Tamber. Let's see. I think we put those up. Yeah. And Sophia, yeah, we did. Sophia. Let's see. Never give up. Have I? Yeah. No, because I can't give up. You know why? You know why? Because I look in their eyes. I even on my camera. Hey, Deb. That's exactly right. We're all here together. Y'all, we can all make a difference. If you just make one little difference, like one little thing, call somebody out, educate somebody. That's all it takes. Because together we know we are, the louder we become. And sometimes you cannot unhear what you've heard. So, love y'all, and I will see y'all later. And I'm going to wait, what's tomorrow's Friday, right? Saturday, y'all don't forget. Don't forget on Saturday. We're going to have John and Ben hosting. You too, Barbie. Thank you. And Sophia, thank you. But yep, so don't forget about Saturday at 7 p.m. Central Standard Time. You're going to have John and Ben as requested by all the ladies. Bye, Station. I will see y'all later. Everybody have a great night.